Hey guys, if you can hear me okay and see me, can you please let me know in the chat because we are having some pretty crazy technical difficulties today. So I would love to know if this stream is working as it's supposed to for you. I'm just going to take one more second here to confirm that things seem to be working as intended, and then we'll dive into what we're going to be covering. Okay, looks like it's working, hopefully. I do apologize for that. Not that anyone needed more stress today. So, today we're going to be discussing what we know about the government shutdown so far. And obviously, there's been a lot of news about this. Lots of people are discussing this. For the purposes of this stream, we are going to be discussing specifically the impact for various programs that I know you guys rely on. We're going to be specifically focusing on the news that's going to affect people. I definitely don't want to dive necessarily into the weeds politically, but I want you guys to know what to expect because I have found some things that are pretty crazy. Oh my goodness. Thanks to all of you in the chat who are letting me know it's working. This was my third attempt at getting this going today. So, all right, let's dive in and get those details. So, as you are probably already aware, the federal government shut down at 12:01 a.m. this morning because Congress could not agree on any new funding resolutions. The way this works is that programs or agencies whose funding depends on those annual budget bills are basically going to have to stop working for the most part until Congress is able to provide more money for them. Programs that are considered essential or mandatory can still continue. There are other agencies that have received funding in certain ways that will also be able to stay operational. But for the most part, things are going to be winding down. Services may be slower than expected. And many federal workers are actually expected to still show up for work without pay, which is kind of messed up. But anyway, we'll get to that in here in just a minute. One of the big takeaways is nobody really knows how long this thing is going to last. I'm seeing a lot of reports that it's expected to last at least 3 days. But it may take longer, which is why I think it's so important that everybody know kind of how each agency is going to be impacted, what that's going to mean for each category of benefits that you might receive, so on and so forth. And we're going to be breaking that down with checklist slides here in just a moment. If you've been a subscriber of this channel for a long time, you may remember that there was another government shutdown back in 2018. It lasted 35 days. It was the longest one in history. And that also occurred under President Trump. That shutdown eventually resolved without anybody getting exactly what they wanted. But the big difference between that shutdown and this shutdown is that the shutdown in 2018-2019 was a partial shutdown, which means that the government, Congress, had basically funded, they'd passed certain funding bills, but not all of them because there's 12 separate funding bills that they're supposed to get done. So a partial shutdown happens when they've passed some of those appropriations, but not all of them. This time we are in a full shutdown because they passed exactly 0 of those bills that they were supposed to have done. So it is going to be different than what we experienced last time. Now, the last time we had a full government shutdown was actually way back in 2013, which was just very shortly after we started low income relief. We weren't even on YouTube yet. And so we didn't do a lot of that coverage. And I feel like this one is kind of relevant because this was also an argument over the Affordable Care Act, which is part of what we're seeing here again in 2025. Anyway, wanted you to have that kind of a background so that you know this isn't necessarily unprecedented. We've been through this sort of thing before. However, there are some key differences, right? Like I said, this time it's a full shutdown. And there are other things that are different too. And we don't know exactly what all of those are or how it's all going to work. I really liked this quote from CNN here. They said, "With the impasse unresolved, the government shutdown could be unlike any other in recent memory. While no two shutdowns are exactly the same, President Donald Trump and the White House Office of Management and Budget have already signaled that they are willing to use a totally different playbook, urging agencies to downsize workers and programs whose funding has lapsed and which don't align with the president's priorities. That's a direct quote from CNN. And I have seen a lot of signals that this one is going to be different than what we saw before in terms of scope and what's going on. I didn't make a slide about this because I wasn't sure I was going to say it. But there's also some quotes going around from Trump and the OMB. I forget what his role is exactly, but the guy in the Office of Management and Budget, I don't know how to say his last name, so I'm avoiding it. But they were saying that they can make irreversible cuts to different programs now. This is a quote I'm reading off of NBC News. And Trump is allegedly quoted as saying, because of the shutdown, we can do things medically and other ways, including benefits. We can cut large numbers of people, but we don't want to do that. We don't want waste, fraud, and abuse, which we keep hearing over and over again. That's a quote from an NBC article. I have the live ticker of what's going on with the shutdown over here on my screen so that if something happens, I can tell you guys about it. But I don't like that quote because it's talking about cutting medical benefits and there's nothing specific about it. I'm hoping that that's just bluster and that that's not going to go anywhere. But I think it's really important that we stay on top of what these changes are going to entail, because I think it's going to be a lot different than what we've experienced in the past. And of course, our team will always be putting out that information for you. We'll be here 6 days a week, bringing you videos, helping you stay up on what's going on. Hopefully it's not as bad as some of us fear that it might be. We'll just skim over this slide. This is other quotes they made talking about cutting programs and things. And this is like, right now, I'm hoping it's all bluster just to try to get everybody back to the table to negotiate, right? Like, that's what I'm hoping. But ultimately, the longer it goes on, the more things will be disrupted. Agencies have contingency plans, and almost all of them are like, well, until the funding runs out, which gets really dicey. But for now, let's dive in it and talk about specifically what you can expect, because I can see you guys are getting kind of worried here in the comments, and I really hate freaking you out. I'm a little freaked out today. I'm not going to lie. I have some concerns, and I don't want my stress to cause you stress. That's not what this channel is for. So let's move on. So Social Security, big thing I want you to know right now. Your payments are going to be fine. They are part of mandatory spending. If you are getting a Social Security check, whether that's coming from retirement or disability or SSI or what have you, those should continue unaffected, no problem. Okay? They are also going to be, according to their release statement that they had, they're still going to be processing applications for benefits. They're still going to be processing appeals. Any changes you need to report that could impact your payments, such as a change of address, a bank change, things like that, they are still going to be able to take care of that for you. It said, this was interesting. They said that they are going to be continuing the continuing disability reviews and SSI non-medical redeterminations, which is when they double check that you're still eligible for things like disability payments. But there was a clause in there that made it sound like that could change and those might stop if the shutdown lasts too long. I was not able to confirm that today before we got on here. Now, because they're continuing those disability reviews, they'll also continue looking at the appeals for those reviews. They also said there will be reinstatement for benefits for prisoners that are, getting out. Fraud prevention, IT support, those sort of things will continue through the shutdown at the Social Security Administration. Now, that being said, there are other things that are going to stop. For example, you will not be able to get your benefit verification letters, and that's going to be really frustrating. I don't know. This seems weird to me, honestly, because if you need a VA benefit verification letter, you can just go on the website and you can download it and it doesn't require a person. I don't know if Social Security has that same functionality. I was pretty sure they said that was available in my Social Security account. So if it is, maybe you can still get that online, but you won't be able to get it like from a person. And I'm not sure if it's still available online. I don't know why it wouldn't be. Wouldn't make sense to me. I didn't check that, so don't quote me on that. But yeah, they're also not going to be issuing Medicare replacement cards. They won't be making corrections to earning records. They will not be processing new overpayment penalties. They won't be suspending benefits for people who go to prison, I guess. And it also said that they will not be filling Freedom of Information Act requests, which seems a little interesting to me, but I'm going to try to stay off of my own opinions today. Here's one thing I haven't heard a lot of people talking about, and I am going to dive deeper into this tomorrow. I plan to spend the rest of my research hours today looking into the facts of this for you so I can get more information on this. It does appear that the shutdown may have an impact on those annual COLA payments. And I know that is a big deal because those cost of living adjustments that you get at the end of every year are really important. Now, the reason this may affect your COLA, based on the research I did today, again, I'm going to be back tomorrow with better details on this. The Social Security announcements for that COLA are based on a report that is issued by the Bureau of Labor Statistics. So the way it goes is every year, the BLS prepares this report. It's called the Consumer Price Index. In fact, they do it multiple times a year, but I think it's every quarter. But they issue that report. And then in October, they issue it in the middle of October, and then the Social Security Administration looks at that report, determines the COLA, makes the COLA announcement. So as part of the shutdown, they have decided that the Department of Labor will be suspending all operations at the Bureau of Labor Statistics. So they also said specifically that economic data that is scheduled to be released during the lapse will not be released, which basically means they are not going to be releasing the CPI report that the Social Security Administration needs to announce the COLA. So, and they knew this was coming because in the DOL contingency plan, it says, quote, a delay of the CPI release during October might have an impact on the cost of living adjustment announcement by the Social Security Administration. So we may not know what the COLA increase is actually going to be until this shutdown is resolved. I am going to be doing a lot more research on this, and I'm going to bring you a better video on this tomorrow talking about exactly how this is going to work. But I did want you to know, just to sum up, your normal Social Security payments are going to be fine, but you may not find out about that COLA increase until we're past whatever it's going to take to resolve the shutdown. So that covers Social Security. If you rely on veterans benefits, your VA benefits should continue to be paid as scheduled. You should still have access to VA medical care. They will still be providing burials and applications for burial benefits. However, they did specify that they will not be processing early needs burial applications. So I don't know if you know this, but if you're a veteran and you're eligible for burial in a VA cemetery, you can apply for that way before you need it. They call it a pre-needs application. They're not going to be dealing with pre-needs applications, but if you have like an urgent need, then they'll deal with it, it sounds like. The Board of Veteran Appeals will continue to run. They will still have their primary call center, Veterans Crisis Line, and VA Benefit Hotline. They will still offer suicide prevention, homeless services, caregiver support, that sort of a thing. However, the VA will not be offering transition programs. They will not have career counseling. The GI Bill line will be gone. The regional offices may be closed. Cemetery maintenance will stop. Lots of other ancillary things will be stopping. I see a lot of stuff going on in the chat, and I really appreciate you guys. I am looking forward to diving in there. We just have some more slides to go through. I think a lot of your questions may be answered as we go through these, so that's why I'm not answering yet. Okay, so housing and urban development. This is, HUD. They do all the housing programs. Sorry. Their contingency plan says that mortgage insurance will continue. Grants that are already obligated will be paid. They said that programs that address imminent threats to health or welfare will continue if funding is available. And then here's the part that, of course, we don't like very much. It says that monthly subsidy programs such as public housing operating subsidies, housing choice vouchers, and multifamily assistance contracts will continue to operate as long as funding remains available. And it says very clearly in another section there that those housing choice vouchers could run out of funding if the shutdown lasts too long. That is a massive and major concern because I know a lot of you rely on those to maintain your housing. So hopefully this thing just doesn't go on very long and that is not an issue. I could not find any sort of verification about how much funding they have available or how long it may last. But I really hope we don't see that run out of money. That is something I thought you should be aware of. They also said that most of their fair housing activities will also be stopping, and there's other stuff that they'll be discontinuing as well. So, yeah, like I said, a lot of these slides will answer your questions because I just saw this pop up on screen about what's going on with Section 8. So now you know. It should be fine as long as we're not shut down so long that it runs out of money. So, yeah. Okay, let's dive into the next one here. So for SNAP, those payments will be sent out as scheduled in October. Their contingency plan does specifically state that October, like they already knew that was going to be an issue, so they dealt with it. It sounded like they had, the way they phrased this, they said they had multi-year contingency funds that could be used to provide funding, and it sounds like they can even use those to issue benefits. So it sounds like SNAP is going to be okay. But again, all of this is contingent on those funds not running out of money, and it depends on how long the shutdown is going to take. So for now, SNAP should be okay. They will not be authorizing any new stores, and they won't have any technical assistance available for states. So hopefully we don't see anything go wrong on the technical side. But for now, mostly good news for SNAP there. So WIC, there's a lot of confusing information about what's going on with WIC. So the official documentation says that WIC will continue using funds that they already had available. I saw another report on CNN where they said that it could run out of money by next week, but that wasn't corroborated by the data that I saw in the contingency plan, so I do not know. I'll be watching that one closely because I know that WIC is, super important. So, okay. CMS, Medicare and Medicaid, right? Healthcare is so important. Now, I know we went over that quote earlier that I saw on NBC where they talked about cutting things from medical benefits, and there was no clarification in that quote. They didn't tell us what to expect. They didn't explain what they were thinking of. As far as I can tell from the official release on the CMS website, okay, Medicare continues to be unaffected. And I did confirm that with my contact at Chapter, our sponsor down there. You can see their number. They offer free Medicare help. I talked to them. They said it was mandatory spending. Medicare should continue completely uninterrupted. And Chapter is still available to help you if you have any Medicare questions. I strongly recommend using that number. They're really great about helping you make sure that you're on the right plan, that you're getting the most out of those benefits. It only takes like 20 minutes. And they said they save seniors on average like over $1,000, which is huge. Anyway, that's the number down there. So, and I think I specified that they're our partner as well. So yeah. Okay. So that covers Medicare. Medicaid will continue through at least the first quarter of fiscal year 2026, which ends December 31st. It sounded like it would be okay longer than that possibly, but they did specify that the funding is available at least through the end of December. CHIP is expected to continue to make payments to the states. The federal marketplace activities are expected to continue, and their fraud and abuse control center is also expected to continue. They did say that beneficiary casework would largely be suspended, which doesn't sound like it's entirely suspended. So I'm not entirely sure where the breakdown is on what is and isn't continuing from a casework angle. They did say they will be discontinuing healthcare facility surveys and certifications, policies and rulemaking, all those other ancillary things that don't directly affect your benefits. Okay. Now, other programs that you may be concerned about, the Department of Education has specified that federal Pell Grants will continue, federal student loan disbursements will continue. They'll still send you student loan bills if you owe. The Department of Labor has said that unemployment benefits should continue, and funding for programs like the Black Lung Benefits Act and other specific programs like that will also continue as long as their funding has not lapsed. It does sound like that funding is only available for those who are already approved, because I'm not entirely sure that they're still going to be accepting claims for that, because things like the Benefits Review Board are going to be suspended. Veterans Employment and Training Services are also suspended, things like that. So, okay. And then the Department of Homeland Security's Disaster Relief Fund activities will continue. I think I already went over Department of Labor. Sorry, I messed up that slide. This was interesting. I saw a report that federal courts will continue operations through October 17th. The Supreme Court will maintain its operations, but in a lot of cases, anything involving the government has to be postponed. So any of those open civil cases that we've been watching are also going to be postponed during the shutdown and for at least 5 days thereafter. Just an interesting tidbit for you. So, okay, yeah, the IRS has special funding available. So they did, I've seen conflicting reports on this. A lot of places are saying, oh yeah, they're going to stay open for 5 days and then they're going to shut down. But when I read the report, and again, I'm not a lawyer, I don't work with the government, I'm just a person who's spent way too much time researching all this stuff. It sounded like they're not shutting down, because they have special funding from the Inflation Reduction Act that actually keeps the IRS going through like 2031 or something like that. As far as people working without pay, Department of Transportation, the TSA employees, air traffic controllers, military, and others are all expected to show up for work, even though their paychecks will basically be on hold until the shutdown is over. Now, in past shutdowns, we have seen efforts be made in Congress to pass special rules so that those people, especially the military, can get paid despite the shutdown, which is honestly just the right thing to do. But I haven't seen any of those things move forward yet. And like I said, they're expecting the shutdown to last at least 3 days at this point. So might be a while before we see any movement on any of those points. Now, again, just a quick shout out to our sponsor chapter. They're awesome at helping you with all of your Medicare questions. I personally get really overwhelmed by Medicare because there's like 20,000 different plans out there and it's just very complicated, which is why I love to refer you to talking to them. I'm going to go ahead and jump in the chat now and see what your questions are and if there's anything I can do to help clear things up for you. Hopefully, we got some good information to you in those slides, but I want to see if I can catch up with you guys. So let's see. Yeah, Amanda's saying that she's having a hard time reaching a housing voucher case manager. So interestingly, each organization, each agency has to release what they call a shutdown contingency plan that explains how things are going to go if it shuts down. And a lot of them said that it would only take about a half of a day to shut it down, furlough the workers, get things moving. So it's possible that that would be the reason why. It's also possible that they were just absolutely bombarded with calls and outreach, because, yeah, I imagine a lot of people are trying to reach out to them at this point in time. Oh, thank you, Sue, for the like button reminder. I appreciate that so much. That really helps our channel. So you are awesome. I really appreciate that you pop in there with us so frequently. Okay, Nana7 is asking, I'm sorry, things are moving faster than I can click on them. Social Security disability insurance will not stop. Those payments will continue as scheduled. Let's see, we can probably, oh man, I wish my tool had the slides labeled. I'd hop back there for you. Any payments you're getting from Social Security should continue just fine. We're just probably not going to find out about that COLA increase until after the shutdown resolves. I'm going to do another video on that tomorrow because, like I said, I have more research I need to do on that point because it wasn't entirely clear. Let's see. Ooh, this is a great question. Will SNAP and Medicaid renewals stop being processed? I don't know. Those are usually handled by the states, so I don't imagine that they would stop, because what I read said that they had that multi-year reserve fund that could be used for administrative costs. So I'm not 100% sure on the answer to this question, but I don't think they're going to stop. I will make a note to research that in greater depth, and I'll come back with another video for you guys explaining that in greater detail, because that is an excellent question. Oh, Warden, thank you. I appreciate that. I always look forward to coming on here and talking to you guys. You're awesome. Thank you. Let's see. Okay. A lot of you are asking about LIHEAP, and that is a great question. I didn't look at LIHEAP, and I really should have. I will make another video talking about what's going on with LIHEAP, because honestly, it's been really confusing, and I'm sure you're confused too, right? We heard reports it was fine, and then we heard they're cutting the budget, and then they didn't get the budget figured out, which is why we're now in a shutdown. So because that funding, I don't know. I would assume that LIHEAP is probably suspended, but that is an assumption. I will make a note of that. Actually, I'm going to open up a little notepad here really quick so that I don't forget. So I need to look into LIHEAP and SNAP Medicaid renewals. All right. If you guys have anything else, I'll always be honest with you, right? If I don't know, I'm not going to give you misinformation. I will absolutely dive in and do that research for you. So please don't be afraid to ask me any questions. I like doing research. I was that nerd in high school that always enjoyed doing reports. So love answering those questions for you guys. Let's see. What else do we got going on here? Yes. So Devin is saying Medicaid, Medicare, and Social Security will not be impacted. That is mostly correct. Medicaid is kind of a wild card. It will not be impacted immediately, but heaven forbid this shutdown carry on into 2026 somehow, which would be historic. It has never lasted that long. But I did see that potentially if the shutdown lasted too long, Medicaid could be at risk, but that is very unlikely. I'm not trying to freak anybody out. I'm just trying to make sure you guys have the facts. It's very unlikely that Medicaid would be affected, but it is more vulnerable than Medicare and Social Security is. Let's see. Oh, yay. Thank you, Jeanette. This is fantastic. I really appreciate this. So the benefit letter can still be printed, it sounds like, from the My Social Security portal. So even though they said they're not going to be offering those benefit verification letters, if you can get into your account, you should still be able to get those. And that is tremendous because they're needed for so many different things. I'm so glad that that is still available. That's awesome news. Okay. Let's see. I don't know what this talk about permission needed is going on here in the comments. If somebody can catch me up on something I missed, that would be great. Little bit concerned about that just because we've had a scammer issue. So anyway, if someone can really quickly pop in there and tell me what's going on, that'd be fantastic. Let's see. Okay. Yeah, a stimulus check. We all wish. At this point, Congress can't even agree on how to keep the government open. So I don't think we'll be seeing any sort of stimulus check anytime soon. I know everybody really wants one. It would be super helpful, but we need to get the government open before they're going to tackle any questions like that. So yes, Deborah's asking if people are working without pay, they will get their pay that's owed to them when the shutdown ends. They should be covered for that time. So that would be, that is the hope. But still, even with that promise, I mean, that's really hard to go to your landlord or your mortgage company and be like, hey, so I have no idea how long it's going to be until I get paid. Please don't kick me out, right? Like that's such a hardship to put on those federal workers and their families. I can't even imagine that. That is so stressful. So let's see. Yes, DH, this is great advice. So even if LIHEAP is not still going, and we know that they've been working on cutting it, there are other forms of utility assistance out there. Your utility company can usually tell you where to go because they're the ones that receive the help from the different programs. A lot of utility providers have different plans that they personally offer. They partner with different organizations that offer assistance. If you are worried about your utilities, please reach out to your local utility company and ask for assistance. All right, Midnight Goblin is asking about child support payments. Now, this is not a 100% answer because I am pulling on the best of my knowledge here. My understanding is that it should be fine because I'm pretty sure all of that is managed at the state level and not the federal government. But I will make a note to look into that in greater depth and get back to you if that answer is wrong. So thank you for asking that. I really, really appreciate it. Let's see. So Joseph is asking the shutdown is only for a few days. That is not actually accurate. They are reporting that it will be at least 3 days. And the reason they're reporting it that way is because, first of all, they let Congress go for Thursday. Like nobody's going to be there. I think I forget what the holiday is, but there's some sort of holiday or something in the Senate's not even going to be in town. So they're saying that it's going to take at least 3 days for this thing to resolve. That's a best case scenario. That's not a guarantee that it'll wrap up in just a couple of days. So, yeah, I'm with you on this one, Violetta. I hope Medicaid isn't affected either, because I know how absolutely catastrophic that would be for so many people. I know I talk about my brother a lot on this channel because I just lost him. He passed away about 5 months ago. Can't believe it's been 5 months ago. But Medicaid was paying for his hospice care. And if we had lost that, like that would have been absolutely catastrophic. I can't even imagine. So we'll definitely be hoping and praying that Medicaid isn't touched. Let's see. Oh, thank you. I love the comment about the research stuff. That was fantastic. Okay. I see. There was somebody who's asking for permission to give helpful info. I'm always interested in seeing helpful info in the chat. Like that's, we I don't know how to approve links. I think links are banned. There's I really need to find somebody who can sit here and help me moderate the chat in these live streams because I love talking to you guys. I'm just not 100% sure to yeah. Anyway. Viewfinder says, you mean all those early September stimulus were fake? Yeah, I don't know. I didn't see anything. I will admit to you, I do YouTube as my job. I have a lot of different channels that I run, so I don't watch a lot of YouTube because it's kind of become work to me. So I'm not sure what you saw about stimulus checks, but I would imagine that they were absolutely fake. There hasn't been anything authoritative about stimulus checks coming out in a long time. So, got it. Okay, yeah. Let's see. Yeah, so I'm going to be honest with you guys. Like I said, I do YouTube as a job, right? Like I have this channel. I've got 14 other channels, I think. I don't run all of them as much as I spend most of my time with you guys. But there's a reason that YouTubers keep talking about stimulus checks. And it's because most of them kind of hit peak revenue during that season. And they're trying to make more money. It's a money grab. And it's really, really frustrating, right? I mean, everybody's got to make a living, but I absolutely hate misinformation and misleading people. It's gross. But yeah, if you see people talking about stimulus checks, please be very, very, very skeptical. Very, very skeptical. We have seen no indication that anything like that is going to be offered for a very long time. Like we heard something about Doge dividends like months and months ago, and I did a video on that you can go back and look at. But even that was like a very hypothetical, maybe someday in the future we might consider doing this thing, and there was nothing concrete about it at all. So you would not believe how much time I spend looking for information on how to get more money to you guys. If there ever is any sort of announcement that is legitimate about stimulus checks, I will be shouting it from the rooftops. It's just not in the cards right now, unfortunately. So I see a lot of people asking questions that are circling back to points we made earlier in the video about housing and Social Security and things like that. So if you have those kinds of questions, I would recommend that you rewind this video a little bit because we went through a whole slide deck here. We had 21 slides of how different programs will be affected, and I don't want to bore those of you that have been with me this whole time. So feel free to rewind at any point if you missed anything. Let's see. Yeah, Melissa's saying, how about if our elected officials worked without pay? Honestly, I feel like that would be more fair than making air traffic controllers of the military work without pay. We know that won't ever happen, though. So let's see. Oh, okay. Yeah. So Marie is talking about applying for out of state housing vouchers. And that is actually a thing that I have seen people do. It is a little bit more complicated, obviously, because a lot of housing vouchers, I mean, they're managed at a very local level by your local PHA. So it's not clear if all PHAs will let you do this, but you can sometimes apply for that. Just be aware that like everywhere has a massive wait list, right? I don't think there's anywhere where it's like, oh yeah, I can just go get one because so many people need that sort of assistance. But there really is like there's all sorts of amazing things you can do with housing vouchers. In fact, I remember it was a long time ago now, but I had a friend who was a social worker, and he came over after school one day. He was at college, and he was like, "Oh my gosh, did you know you could buy a house with a Section 8 voucher?" And I had never heard that before, and I was so excited. I did a bunch of research on it, but there are even areas where you can take that housing voucher and use it toward buying a house, which is so much better than renting, I think. But yeah, there's all sorts of fun stuff with housing vouchers. If you guys want me to do more videos on that, just let me know. Historically, when I've done videos on like Section 8 housing voucher type stuff, people don't tend to watch them. So I wasn't sure if that was information that you guys wanted, but if you want it, by all means, let me know. I love geeking out about that sort of stuff. So let's see. I'm going to jump in here and see if I can find some more questions. Oh yeah, Wendy's talking about if they did stimulus checks, it'd be for working people. That was one of the things with Doge dividends that people weren't catching in the notes, was that it was specifically only for people who were working and paying taxes, and most low income people were never going to get one under the proposal that I read. So that was, yeah, that seems to be the way that things are currently trending. Yeah. Let's see. Oh, this is great. Kimberly says she got help through a local agency yesterday with her electric bill. That's fantastic. Yeah. I cannot stress enough how much those local agencies are just becoming more and more critical, especially as we're having issues with LIHEAP and other things. Don't ever assume that that just because one option is a no, or it's out of funding, or you can't get it, that is the only option out there. If I've learned anything from running low income relief, it's that there are so many different organizations that offer similar assistance that like there may be other options out there that can help you, and it's always worth chasing it down. So let's see. Oh, I love all you guys. These comments are amazing. You guys are awesome. Oh yeah, Mary's pointing out that starting October 1st in a lot of areas, you get those disconnection moratoriums, is what they call them. But a lot of states have those rules where it's like, okay, it's winter now, you can't disconnect people because that kind of intense cold can be fatal in some cases, right? So they have those moratoriums where in certain seasons they can't disconnect your utilities, which is a really good protection to be aware of. It's not available everywhere, but it is available in a lot of places. So definitely good to look into those as well. So let's see. Let's see. Sorry, I feel so bad when you guys are watching me read through comments. I don't want to waste your time. Let's see. I must not even be caught up with. Okay, I see what's going on here. So a lot of you were saying, yeah, you already got your SNAP for the month of October, and that's awesome. I know most people do get it on the 1st. There are some states where it's determined by the last digit of your case number, or your birthday, or your social security number. Like the states do it all sorts of different ways. So a lot of our talk about October SNAP being okay was aimed at those who maybe have to wait till later in the month and would be super nervous about whether or not that was coming. So, yeah. Wow. Some of like, okay. I don't understand some of what I'm seeing here in the comments, but we can deal with that later. Oh, that's a good point, Scoop. I hadn't thought about that, but the low view count on the housing videos could be due to lack of availability. That is a very fair thought. I hadn't considered that. Yeah, some of you are saying things in here that I really agree with. This is awesome. Okay, so Michael is asking, it sounds like a lot of questions about SNAP benefits, and this is separate from the shutdown, of course. So we do know that 12 states have been given waivers to block candy or soda or energy drink purchases. Some of them have gone a little crazy with the way that they are outlining that, and they're banning like granola bars and all sorts of other stuff too. So there are a couple of different answers for this particular question. First of all, in most areas, in the majority of the United States, you can still buy, snacks, chips, cookies, that sort of a thing with your EBT. It's those 12 waiver states where we're going to start to see that changing first. And those changes are supposed to go into effect. The earliest date I've seen for that implementation is going to be in January. Now, it'll be interesting to see if the shutdown changes those implementation dates at all. As far as fast food, that refers to the restaurant meals program, which is a loophole in the federal food stamps law that allows states to decide whether or not they want to let EBT be used at fast food restaurants. Now, before you guys massacre me in the comments, that program is limited to people who are homeless, elderly, or disabled, and therefore unable to prepare their own meals at home. When we talk about this, a lot of people get confused. They think that just anybody can go to McDonald's with their SNAP benefits, and that's not how that works. That program is designed to help people who cannot safely prepare their own meals get food in a way that is accessible to them. And it is limited to people who are over a certain age or disabled or homeless. That is only available in, I think, 7 states now. When I first started low income relief, it was like 3. I think it's available in 7 states now. I haven't seen any indication that that is changing yet, but I would not be surprised to see it come under attack at some point, because obviously it doesn't dovetail with a lot of the changes that are being made by the current administration. So for now, my understanding is that the restaurant meals program is still operational, but again, wouldn't necessarily surprise me if that changed in the future. As far as hot prepared food, that has always been prohibited by the SNAP program. So some states are working on changing those rules, but for now, I don't believe there's been any change made to those rules at this time. So yeah, so that answers that question, hopefully in a thorough and easy to understand way. I know some of those programs get really confusing when you're talking about the state by state differences. It can get really kind of messy. So hopefully that made sense. Shirley is saying 211 in Connecticut is awesome if you live there. And 211 is available in a lot of different states. It is more helpful in some states than others, but I do recommend 211 as a resource to help you find things that are in your area that may be able to help you out. So yeah. Let's see. Oh my gosh. Okay, hang on. Let's see. All right. If you guys notice somebody trolling in the chat, I have figured out how to block users. And I think I may have blocked some people by mistake last time. But if you notice someone who's trolling, let me know their username and I'll see if I can get that taken care of while I'm on here. Okay, let's see. Yes. So Lisa is recapping that if you get your SNAP, you should get your SNAP benefits for October just fine. But if it takes longer, there might be a problem. From what I read in the USDA paperwork, I'm a little bit more optimistic. It sounded like there was more funding available for future months, and I'm choosing to believe that things are going to be okay based on what I read there. Hopefully it'll turn out just fine. But yes, generally in shutdowns, SNAP has a problem after a while. So hopefully it doesn't go on too long. Yes. Okay. So those of you calling out this particular troll, I have banned them from the chat now. So we're good there. Those of you who are asking about my other YouTube channels, Low Income Relief is far and away my most popular YouTube channel. We also have a second channel for Low Income Relief. It's called Fast Facts by Low Income Relief. And that video has a lot more shorts on it, has a lot more state specific videos because I can't really do those on this channel very well. So if you're interested in even more assistance, go check out Fast Facts by Low Income Relief, because we've got a lot. I think we're posting like 3 videos a day on that one. So definitely go check that out. That's one of my other favorite channels. The other ones I run aren't really too relevant. We've got a positivity channel, and then some hobby-based things, and then things I help my friends with. So let's see. Oh, thank you, Praiseworthy. I really appreciate this so much. Oh my gosh. Tired Tested, you too. You guys are so awesome. I just absolutely adore you. Yes, the person who was talking about buying whiskey with Snap is trolling. They are very clearly trolling. That is super not allowed with your Snap benefits. And there's also, if you knowingly buy something with Snap that you know should not be Snap eligible, they call that an intentional program violation. And that is a really big deal, because if you have an IPV, it can cause you to be banned from the SNAP program. I believe in most cases I think it's 12 months for the first offense, 24 months for the second offense, and then if you do it a third time, it's a permanent lifetime ban, as in you can never get SNAP again, no matter how badly you need it. So please don't listen to people when they're like, oh, I bought alcohol with my SNAP card. Don't do that. Even if there is a glitch, and I have seen glitches at different retailers where people have been able to buy things they shouldn't have been able to, be so careful, because it can cause massive penalties. So yeah, don't do the bad things, I guess, is what I'm trying to say, because that's really, really a problem. Let's see. Yeah, Viewfinders is talking about being able to shop, go to Denny's and stuff, and that is true. In most states, if you are over, okay, let me correct myself. In the states that have implemented the restaurant meals program, if you are over the cutoff age, or if you're on disability, or if you're homeless, they can automatically enable that so that you can go to certain restaurants. Not every restaurant accepts SNAP, even in the states with the restaurant meals program. We have a list of all the restaurants that take it on our website at lowincomerelief.com/RMP. So yeah, anyway. Yeah, so Amanda's saying that there was some stuff about SNAP being cut off. I will definitely look into that and get back to you. We live in this era now where it's so hard to figure out what's true, and that's kind of my entire job. Is I spend all this time researching and investigating and trying to figure out what the truth is and how to explain it in an easy way. And I love that I get to do that, but it's getting harder to figure out what's true, because the use of AI and AI video and everything else, it takes a lot to filter out and fact check things. So a lot of things like this, I'm not going to make a judgment call here on it on the live, because I'm going to need to dive in and see what I see. But I'll definitely hop back in with another video, because of course, if anything major is happening with Snap, that's something we all need to know about right away. So let's see. That's interesting. You guys are awesome. I just absolutely love all your feedback in here. Oh, thank you, Sue, for another like button reminder. You're so cool. I so much appreciate that. That's so helpful. That's interesting. I'm hearing from a lot of you that are having a hard time with SNAP and Medicaid renewals, and that is definitely concerning. I'm going to make a note here. I will look into that as soon as we are off this chat, because that is concerning. If you actually, you know what, if you, like I see Tired Tested in here, and there's a couple of other people who have made these comments. If you have had a problem recently with a SNAP or Medicaid renewal, if you can send me an email at tips, TIPS, at lowincomerelief.com, that will go straight to my assistant, Stephanie. She can make sure that I see that. That would help me research that and figure out what's going on there, because I definitely want to dive into that and figure out what's going on. Let's see. You guys are so cool. Oh my goodness. Thank you so much for that that super chat, Marie. That's so cool. I really helps our team. That's fantastic. Very much appreciate that. Oh yeah. So Sue typed it up for me. Thank you. I have a hard time typing and talking at the same time. Multitasking is not my skill set. But Sue typed this up. This is the name of that second channel that I run, that where we go into more detail on some things, and we have the state by state stuff and all of that. And then Linda Lou was saying we all need positivity, and that's a great point. So my positivity channel is called Hope, Healing, Optimism, Positivity, and Encouragement. Doesn't have a lot of videos on it yet, but we are working on expanding that as well, especially I think during this shutdown. I think we're going to be doing a lot more on that channel because we all need more good news. Definitely need more good news. Let's see. Oh, this is interesting. Bill is saying LIHEAP is going to start accepting applications in November instead of October this year in Oregon. So that is good. We'll be looking into that and trying to get dates for all the states too, because I know some states, even when it's running as it's supposed to, some states like do seniors 1 month and then like different things. So we'll be looking into that in greater detail as well. Let's see. Okay. Yes, we do have automatic filters for those of you who are discussing like the filters that we have in place. We have a lot of filters on our comment section. I don't know how it all applies to live chat, but we have so many banned words for the actual comments because we've had so many trolls over the years, and they are really aggressive. Like, it is really hard to keep bots and trolls out of the comments. Yeah, let's see. Ooh, this is great. If you're a senior in Oregon, they're already making appointments for LIHEAP. So, so if you're a senior in Oregon, I would recommend that you call. That's probably your community action council, I would imagine. Call them, get an appointment right away, because those funds are always first come, first serve, and you don't want to miss your chance for any of that. So, let's see. Yeah, so Gina's talking about different government organizations having different notices on there. That was one thing that was really frustrating about this specific shutdown that we're in right now, because typically one of the agencies will list the contingency plans for all of the other ones so that it's really easy to track and keep track of like who's doing what and what's going to happen. They didn't do that this time. They decided that each organization was going to issue its own notice independently, and some of them were remarkably difficult to find. And so one of my tasks that's on my to-do list here today is to go in there and try to tabulate on our website all the different links for all the contingency plans so that you guys can look through them yourselves if you're interested. Because I think having those original sources is really important, especially because, as you know, I'm not, a lawyer. I don't work with the government. I'm just a researcher. So I want you to be able to have access to all of that information. Yeah, so lots of you are, again, asking questions that we addressed earlier in the video. The first, oh my goodness, we've been going almost an hour now, but I'd say the first like 15 to 20 minutes, we were going through the slide deck of all the different changes that are going to be rolling out. So I would go, rewind and take a look at that if you still have questions. Let's see. Oh my goodness. In Georgia, LIHEAP is not taking applications until December, January. That feels like it's late. That's really frustrating. We definitely need to get that list together of what's going on when. Oh, you guys are so awesome. I really appreciate all of your encouragement in here. Yeah, so Praiseworthy's talking about getting SNAP a little bit early. So they did say in the contingency plan for the USDA that they had made arrangements to make sure everyone got their EBT in October. So that might be part of what that was. I just love how much you guys are all chatting. This is awesome. Yeah, Michael's talking about how awesome 211 is in California too. When I use 211, I tend to use their website instead of calling in because, I mean, obviously I'm doing research for everybody everywhere. So it's just more efficient for me to use the website. And some states have really awesome 211 websites, and some of them are a lot harder to use. Like I die inside every time I have to try to find something in the Texas 211 because it's especially difficult. But some of them, like California, are super easy to use. So I always recommend those. Oh, yay, I'm so glad you caught us live, viewfinders. That's so cool. Let's see. Disabled. Ooh, okay, Lisa, I'm gonna need some more information. The application to prove you're disabled or website. I don't remember. Maybe someone else can remind me too. I don't remember mentioning anything about that this time, but if I can get more information, I'll try to help you figure out what I was talking about. Because yeah, I apologize if I made anything confusing. Yes. So Beck is saying whoever mentioned flex cards, be aware that there are going to be upcoming changes. So flex cards are usually a part of Medicare Advantage plans, and they do change drastically every year. I think last year we saw millions, like they were dropping out of whole states, and it was messy, and there was like over 1 million plans impacted and stuff. And there are over 20,000 Medicare plans out there, which is a ridiculous number of Medicare plans, in my opinion. And it's really hard to keep track of what's going on with all of those, which is why whenever there is any sort of Medicare question, I like to refer to my partner chapter over here with this number, because that is their job. They have a database of all the different plans. And when they talk to you, they like to figure out, well, what doctors do you need to see? What medications do you need? And they run all the numbers and figure out all the things. And they have way more information than I do. So for all things Medicare, I like to point out to them. But yes, there are changes definitely coming. Oh, this is actually great, Praiseworthy. That is a great idea. I definitely need a moderator or two or more. If you wanted to email tips@lowincomerelief.com and make sure to mention your username and stuff, then we can get connected and discuss that a little bit further. Let's see. What else do we got? Ooh, this is so cool. Anxiety Sauce. First of all, I love the name. But also she says, I checked the missing money site and found I was owed a little over $300 from 3 different places in California. That is so awesome. I love hearing about how this information helps you guys. But yes, if you haven't checked for unclaimed money, please go do that, because it is, the states are just holding on to it, waiting for people to claim what's theirs. So definitely, that's just awesome. Oh, that made my day. Okay. Redhead says in Minnesota, LIHEAP is already taking applications. So that's great to know. Yay. Lots of you are talking about that. In Minnesota, I already put in fuel assistance application. That's awesome. Oh my gosh, Miss Audrey got over $1,000 from the missing money site. That's so great. Oh, I love this. This is so cool. Yay. Let's see. Okay, Appalachian Granny has a great question. And again, this is separate from the shutdown, but the medical conditions that will be exempt from the new work requirements. So if you are on any form of official disability, whether that's going to be VA, or maybe you're on Social Security disability or SSI or what have you, a lot of times that is the easiest way to prove that you're unable to work, because you're already getting some form of disability. As far as if you don't have those benefits, I did see a lot of reports that you can get like a doctor's statement. I don't know if there's going to be a specific form they want used, or if you just need your doctor to explain how your conditions would affect your ability to work. I haven't seen a specific list of medical conditions that they're like specifically looking for, and I doubt they would have that, because there's just so many different types of conditions out there. But I did see something that said that physical, mental, and in like different categories are all going to count as well. So if you're on a disability program, I would use your like benefit verification letter. And if you're not, then I would get a statement from your doctor talking about like what kind of limitations you have and how that prevents you from working. So yeah, hopefully that was helpful. Let's see. Oh, Michael, this is scary to me. It says millions of people are going to be cut off from SNAP from what we heard today. All right, I'm going to. making a note to research that as soon as we get off of here, because I definitely need to dive in. And if I find anything out, you guys know I'll just jump back on and talk to you guys about it, because yeah, I want to look into that in greater detail. Alrighty. Let's see. Yeah, Amanda's talking about how fast you have to make an appointment for LIHEAP once they open to the public, and that is so true, because that funding just goes so fast. Oh, okay. So Bill says that she was probably talking about the award benefit verification letter, and I think this is in response to what Lisa said earlier. So that was inside your My Social Security account. If you're getting Social Security benefits, you should be able to log into your My Social Security account and then get those award and benefit verification letters that way. So, yeah. Doing these live streams, I've gotten a lot more self-conscious about all of the little things that I say when I'm reading. So I am acutely aware of every time I say and I do apologize. Please know that I am working on that. Maybe in some day, years from now, you guys will be able to get on here and not listen to me stutter and make silly noises when I'm trying to catch up on the chat. But that day is clearly not this day. So yeah. Okay, Cuddlewing Dragon says, what is Missing Money? So Missing Money is the nationwide website that helps you connect with each state's usually Department of Revenue, which holds on to unclaimed resources. So if you had a bank account and then you moved and you forgot about the bank account, I don't know how people do that, but allegedly people do, and there was a balance and then the account closed and they couldn't find you, then they send that money to the state and the state holds on to it for you. And it's not just bank accounts. It's also like utility deposits. And that one I understand because I've moved a lot. So you pay a deposit with your utility company and then you move and they don't have your forwarding address, then they can send that money to the state and the state holds on to it for you until you claim it. They do that with all sorts of different things like rebate checks and insurance payouts and just all sorts of different things that can end up in this missing money database. And each state has its own. So if you're somebody like me who has moved way more times than I probably should have, my husband and I have moved 19 times and we've lived in at least 4 or 5 different states, then for someone like me, I have to go in and check, usually each and every state that I've lived in to make sure that I'm getting all of the things. Missing Money is a website that makes that a lot easier. It's just checking really quick here so I don't send you to the wrong place. I believe it's missingmoney.org. And you just search and you can look and see what the state may be holding on to that they should owe you. Because there's billions of dollars there that is just waiting for people to remember it exists. So, yeah, great resource, especially if you're financially hurting. And I mean, getting the money that you should have had is really helpful for everybody. So let's see. All right, just a quick reminder that this channel does have some standards as far as being nice to one another. We do absolutely ban people who are being rude. So just a gentle, most of you are doing great, but I know we've had some trolls in there today. So just a little reminder to, watch tone and things like that. Let's see what else we have here. Okay. Oh, thanks, Mary Jane. I appreciate you. You're awesome. Let's see. Oh, and I did it again. Oh my goodness. I have got to stop that. Let's see. Ooh, Amanda did a missing money claim and it says it could take up to 7 months. That's crazy. Hopefully it doesn't take that long. I'm glad it was easy to make the claim. Hopefully they speed that up for you, though. That's a crazy amount of time to have to wait. Alrighty. Okay. Thank you for that context, DH. I just clicked on the wrong thing. That makes sense to me a little bit. I'm still going to do more research on it before I comment on it, but I think I might know what they're talking about, but I don't want to get it wrong. So I'll come back later after I do some research on that. And then Bess is saying, don't forget money from settlements. And yes, that is huge. Every month we're doing a recap of different settlements you can claim. And it is so tedious to put together because there's so many of them out there. But we've heard from so many people over the years who watched our settlement recap and then got, $150 or whatever. And I know what a difference that can make. So definitely keep tabs on the open settlements. If you guys don't want to dig through all that headache, we'll do it for you. In fact, I think our October recap is going to be coming out later this week, unless we have more shutdown news we have to cover. So sometime in the next week or so, we'll be going over the settlements that you should be claiming this month. But yes, that is a huge, huge thing. And I think I saw that the Facebook settlements are finally starting to be paid out too, which took way too long, but I'm glad that those are finally on the move now too. So, oh, you guys are awesome. Oh, let's see. Sorry to hear about your SSI, Wynette. I hope that you're able to get that resolved. I don't know. I know we have a sponsor that helps with SSDI, but I don't think they do much with SSI. But I don't know. I hope that gets resolved really fast. Let's see. Wow! Mrs. Audrey said that in Iowa, that missing money claim came in super fast in under 2 weeks. What a blessing that is. That is so cool. And again, Betty, that was missingmoney.org is where you search for that. It's awesome. And it's super easy to use. And because this is one other thing I should say before we move on from missing money, because it's something that's continuously in motion, right? Like things get sent to the state all the time. I like to recommend that you check it at least once a year. I usually do it twice a year just to be safe. If you take longer, it'll still be there for you, but why go without what you're owed, right? So checking it frequently is a good idea. So yes, Bess, this is great advice. Appealing is always super important. And I feel like this is something that a lot of people don't know about. And I think part of the reason for that is because you get those big long letters, right? And they're super confusing, but you absolutely should be able to appeal that decision if you lost it. And that can make such a big difference because it's appeal. There's never any harm in appealing. It's always a good idea. So that's awesome. I think, and I can't believe this is true, but I think I may have actually caught up on the chat, which is really surprising because for a while there, I felt like I was just getting more and more behind. Let's see. Okay, yeah. Well, do you guys have any other questions or last minute requests for what you would like me to research? Because right now, I will just recap on my homework list for when I get off of here. I'm going to be looking into LIHEAP, SNAP and Medicaid renewals, making sure everything is still flowing normally with child support, and then talking about this SNAP cutoff that everyone's discussing. That is my homework list. So if you have other things you'd like to throw on there for me, let me know. And you can always email, like I said, tips@lowincomerelief.com. In fact, here, tips@lowincomerelief.com. There we go. Hopefully that came through for you guys. But yeah, that's our email address, and it goes straight to Stephanie, and she can get me information for you guys too if you need something. And those of you, best feel free to type in recommendations and information in the chat, and I'm always open to hearing things. I'm not here to be the only, let me figure out how to phrase this. I know I'm not the only YouTuber out there, and in some cases, I'm not even necessarily probably the best YouTuber out there, but I am very, very aware of scams and misinformation. So I usually don't shout out other YouTubers necessarily during our chats, just because even the ones that I feel like are trustworthy, giving an endorsement like that is a really hard thing for me. I'm really, really careful with our sponsors too. I always vet them really carefully just because if I'm recommending something to you, I want it to be something that I actually trust, that I would trust to use myself, because if I wouldn't use it myself, then I shouldn't tell you to use it, right? That would be wrong. So things like Chapter here that I'm recommending, I drove them crazy because I went around and around and around with them before I ever agreed to say anything, because I wanted to make sure that they were really above board, and I do that with everybody. So you're always welcome to drop things in the chat. If I don't highlight it, it's no offense to you. It's just because I'm not sure I want to endorse that, but I'm always interested in hearing from you guys and what you're finding helpful and who you're following and stuff. Like, that's always great information. So anyway, hopefully that all made sense. Let's see. Oh, this is cool. So when it's saying Salvation Army helped with the light bill, they're usually great with that. So let's see, I think it went out last week. I think we did it, Han. I think we did a video that would be helpful to you. Let me see. I have it up over here. Did I? Okay. Sorry. Sometimes I forget y'all are watching me. Here we go. Yeah, so we did this video the other day. Not a lot of people saw it. Let me grab the link for you really quick. So in a pinch, if you don't have any other resources, this is kind of my go-to list of, oh, geez, it's not going to, kind of my go-to list of different organizations that may be able to assist with different things. So I just dropped that in the chat. Hopefully that's able to help you. I've lived in a lot of rural areas where there just isn't a lot available, and I know how frustrating that can be. Let's see. I see that recommendation in there now. So yeah, that one is usually pretty trustworthy. I'm good with that recommendation. But I have heard mixed things from you guys in the chat. And like I said earlier, I don't watch a lot of YouTube, which is another reason why I'm a little bit about recommending other channels, because I just don't watch a lot of videos. Because I make them all the time. I don't know. Sorry, that was really dumb. Okay. Let's see. All right. I'm so glad you guys are in here with the chat with me. I've heard from a lot of you who usually don't catch the lives, and I think they're a lot of fun. I had a hard time being live at first because I know I'm just a big dork, but I enjoy spending time with you guys and chatting and stuff. Yeah, so I'm going to go ahead and just go ahead and click on this. I know I trust Chapter, and like I said, I went round and around in circles with them, making sure that they weren't just selling you things, and they've promised me upside down and sideways that they'll refer you to the very best plan, even if they don't make any money and it's all free for you and stuff. So I trust Chapter, and Chapter does trust Dr. Ed. So if you're looking into things that are specifically Social Security, he's a pretty good authoritative source, I think. But I have heard other things from you guys in the chat, and I'm open to hearing your concerns as well. So, let's see. Oh, this is a great endorsement. Thank you, DH. I appreciate that. I think you rock. I'm really glad that you're here. All right. Let's see. Wow, we've been doing this for a long time. This is like our second live this week that went over an hour. You guys are so cool. Ooh, okay. Lisa's saying that the governor in New York is issuing an inflation refund check. I'm going to add that to my homework list. I think I remember hearing something about that, but I'm going to go ahead and do some homework on that and get that figured out too. So good information. Okay. Well, I think I'm probably out of time for today. I was supposed to, well, now I have homework too, but I had some other things I needed to do as well. So I'm probably going to get off of here for today. But I really appreciate all of you being here, hanging out with me, having this conversation. I know that this situation with the government shutdown is really hard and it's really stressful. And I don't pretend to know how you're feeling about it yourself individually, but I know for me, like, my anxiety goes absolutely crazy when it comes to the unknown and not knowing what to expect or how things are going to go or any of that. And so I know this situation is very sensitive and very delicate and very hard. And I just want you guys to know, I don't know if you're a person of faith or not, but you are all in my thoughts and prayers. And I am hoping for all of our sakes that this doesn't go on very long. And of course, we'll be here every day, 6 days a week. I don't work on Sundays, but we'll be here 6 days a week, bringing you guys hopefully good news. I'm hoping it's more good news than not, as we all go through this together. So just know you're in my heart. I'm going to take one more quick look here at the chat, and then I'm probably going to hop off for today. So Wynette is asking about the free car deal. There are lots of different free car programs. We have a separate video about that breaks down all the different options. I would have to know which one you were looking at, and I think I gave all the information I had in that video. But if you haven't seen the free car video yet, go check that out because it has tons and tons of information on all your options. Oh, thank you guys. I really appreciate all of you. You guys are so sweet. Let's see. All right. Thank you guys all for being here. I don't think I saw any other questions come in that I needed to answer. So I'm going to go ahead and sign off.